Health officials warn that excessive doctors' visits are overstretching the health insurance system. According to the National Health Insurance Administration, there were 35,000 insurance holders who consulted a doctor more than 90 times in 2019. This small group racked up a healthcare bill of 3.2 billion NT. Last year, the medical system's most avid user was a 43-year-old woman from Southern Taiwan who saw a doctor 466 times. That averages out to 1.3 visits a day. According to officials, one reason for unnecessary visits is that the patient doesn't know where to go to get the remedy needed. Officials say they are reaching out to guide such patients to reduce their impact on the healthcare system.
Doctors' appointments are a part of life, for some more than others. In 2019, 35,000 people saw a doctor more than 90 times each, according to government data. The visits cost the health insurance system 3.2 billion NT.
These might have been people with respiratory problems, the common headache, migraines or anemia, things like that. For the most part, they went to see internal medicine, family medicine, and ear, nose, and throat specialists. We also saw an increase in visits by senior citizens. These accounted for a greater fraction.
But the healthcare system's number one customer wasn't a senior citizen. It was a 43-year-old woman in Southern Taiwan who saw a doctor 466 times in 2019. A 36-year-old woman in Central Taiwan took second place with 413 visits. Third place went to a 32-year-old man in Eastern Taiwan with 412. Honorable mentions belong to an elderly man who did 174 tests in 7 days and a 31-year-old man who collected the same prescription 78 times. The Taiwan Healthcare Reform Foundation is calling for greater integration of Taiwan's private practices to cut down on superfluous doctors' visits. This year, medical visits decreased significantly amid the pandemic. Between January and March last year, there were 90.3 million visits. That figure dropped by 5.34 million in the same period this year. Some argue the data is proof that it's not always necessary to see a doctor.
Before, the doctor may have written prescriptions for fewer days. Now the prescriptions are for more days to reduce the number of hospital visits. And then there's another thing, and it's actually the main reason. Everyone has been washing their hands frequently and wearing face masks, so there's been a massive decrease in people with respiratory conditions. Basically, we at the National Health Insurance Administration care about these people. We actively reach out to them and ask them what assistance they need. It's possible that they really don't know how to navigate the medical system. We want to help them find a better doctor who can help them with all the issues they may have.
Amid government plans to raise national health insurance premiums, officials are also calling for the efficient use of medical resources. They're tackling the issue of excessive visits on several fronts to optimize Taiwan's healthcare system.